All right, WMAR2 News and GBMC Healthcare working for you tonight. We're answering some of your questions about the coronavirus. Joined now by Molly Hyde, infection control practitioner. Thanks so much for joining us.
Thank you for having me.
You know, before December, I'd never heard of the coronavirus. Is it new?
So this particular coronavirus, yes, is new. Coronaviruses as a family are not new. There are lots of different coronaviruses. There's 7 viruses in the coronavirus family. 4 of them cause just common colds, ones you've probably been exposed to and probably had at some point in your life. And then 3 cause more severe disease. This one, COVID-19, as well as MERS and SARS are also in the coronavirus family.
Things that we've heard of. So,
exactly.
So how does it spread? I mean, you've heard so many, and we really want to sort some of the fact from fiction because there's so much information out there.
Yeah, so it spreads through droplet transmission. So that means when somebody coughs or sneezes or talks, the droplets come out of their respiratory airways and can infect somebody by direct transmission. It can also spread through objects, so things like tabletops and doorknobs, where that can get that can get contaminated by a person who was infected, and then somebody who touches that contaminated object can then touch their face and get exposed that way as well.
So I've already had the flu, I've had bronchitis, I've had pneumonia. Does that mean I won't get the coronavirus?
No. So having these other diseases does not give you immunity to coronavirus. They are different diseases, and your immune system responds differently to each one.
So how do you know when you have it, though? Because if you think about all the symptoms, it's the same, you know, the coughing, the fever. I mean, you could have the flu.
Exactly. The symptoms are very, very similar to the flu, and it's very hard to parse out just looking at symptoms whether you have the flu or whether you actually have coronavirus. So really the best way to tell is diagnostic testing.
So and then there's been an issue about that, who can get tested and who can't.
Oh, absolutely. We are seeing a shortage of tests here in the U.S., and so it actually has been difficult for people who are displaying symptoms to get tested themselves.
Okay, so there's talk about, you know, you don't have the symptoms at this point. Can you spread it to somebody else if you're not symptomatic?
It's very tough to say. There have been incidents where people believe that asymptomatic transmission is occurring, but it's very hard to tell how much that is really driving the transmission of this disease.
And we're still really learning a lot about that, isn't it right?
Exactly. We don't know a lot about it, so we really are still learning.
So if you're no longer having the symptoms, can you pass it on to somebody else?
Again, that is not known. There has been viral particles detected in people who have recovered and are no longer symptomatic, but it's difficult to tell whether those viral particles are actually infectious or if it's just pieces of the dead virus.
Is this something that young people need to worry about as well, because we're primarily hearing about older adults and people who are immune compromised?
Sure. It's really something that everybody needs to worry about. That's the whole point of social distancing. Really do your part to stay away and limit the spread. It is much more severe disease in the older populations, but younger people can get it as well, and nobody wants to be sick. So really do your best to try and avoid getting it, no matter what your age group.
There's no question that she can't answer. One of our fine experts from GBMC, we're going to be with them for the next till 6:30. The number to call if you have a question is 410-671-0702.